Coming to the days of salivary glands. Usually, salivary glands, they are known as the exocrine glands because they are so called as exocrine glands because they synthesize synthesize certain products within the glands, as well as they secrete through the ducts into the epithelium. So they are known as exocrine glands. So there are two major groups of glands which can be seen. They are the major glands and the minor glands. Among the major glands, they include the parotid gland, submandibular gland, and sublingual gland. Whereas the minor glands, they include few they are numerous and widely distributed. They are present within the mucosa in the oral cavity, which could be observed in the buccal mucosa, palate, also in the soft palate and the hard palate it can be seen, as well as in certain areas of the dorsal surface of the tongue. So these are the minor salivary glands which are numerous and they are widely spread, and they are lesser in size when compared to smaller in size when compared to that of the major salivary glands. Coming to the ducts, they usually usually the substances which are being synthesized within the glands, they are being secreted into the oral cavity through certain ducts, and these ducts, they are specific for specific major glands. Among them, parotid gland, it shows a Stensen's duct, where it constitutes a Stensen's duct which actually opens opposite towards the second maxillary molar. Coming to the ducts of the submandibular and sublingual gland, they usually drain into the into the floor of the mouth, and among them, the duct of the submandibular gland is known as Warthin's duct. Coming to the other types of the salivary gland tissue, they occur even heterotopic, that is, they occur in an abnormal positioning of the salivary gland tissue, like they might be present even in a lymph node, which could be very rare, or in occasional conditions which can be observed. So this type of abnormal deposition of salivary gland tissue in other than the normal area is known as heterotopic salivary gland tissue. So the major product which is being synthesized by this gland is known as saliva, and this saliva, it is being secreted into the mouth through the ducts of these glands. Coming to the different types of glands, that is the parotid gland and their situation. It is usually located posterior in the mandibular ramus area. That is, it is located posterior to the ramus area, and it is present anterior to the mastoid region. Usually, it secretes 20% of the total amount of saliva, and it constitutes of Stensen's duct through which this saliva is being produced. Next, coming to the submandibular gland, it is usually present just below the lower jaw, and it is present superior to the digastric muscles. It is the one which produces major amount of saliva, which comprises 60 to 70% of the saliva comes from the submandibular gland, and it constitutes of Warthin's duct, which opens into the floor of the mouth. Next, coming as a sublingual gland, it is usually located inferior to the tongue, that is in the floor of the mouth, and it is present anterior to the submandibular gland, but is present below the tongue but above the lower jaw. So it is between these areas, and it produces 5% of the total amount of saliva, and this saliva is usually it is being produced into the mouth or excreted into the mouth from these glands directly from it does not have a specific duct, but rather it has 8 to 20 excretory ducts. And coming to the other glands, that is the minor salivary glands, they contribute up to 800 to 1000 minor salivary glands. Since they are smaller in size, they are present throughout the oral cavity, and they are located within the oral cavity. They are in a layer known as submucosal layer. And these minor salivary glands, they are usually mostly innervated by the facial nerve, and they are present at the dorsum of the tongue, as well as in the buccal mucosa. In the palate can also be seen. Coming to the Von Ebner's gland, the next last classified egg glands, they are usually present in the dorsum surface of the tongue. They are present anterior to the sulcus terminalis, and they are being encircled with the circumvallate papillae. They are usually they help in the continuous flow of the fluid. So these are the glands which are seen in the oral cavity. So there is a picture showing the location of the parotid gland, which is present anterior to the mastoid and in the posterior to the mandibular ramus area. Then coming to the submandibular gland, usually present at the lower below the lower jaw. And then coming the sublingual gland, usually present below the tongue and above the lower jaw. Coming to the histological features, we see that these features they usually the salivary glands, they are usually occur in a characteristic arrangement of tubulo-alveolar glands, that is in the form of tubules, as well as in the alveoli-like pattern, that is in the form of small cells which branch out in the form of a cluster of grapes. So it is known as tubulo-alveolar glands, which shows three types of cells. One is a mucous cell, one is a serous cell, and then is a mixed cell, that is which shows presence of serous as well as mucous cells. So these are the three. This is the structure of the histologically. This is what we observe under a microscope of a normal salivary gland tissue. And this salivary gland tissue, it is usually divided into lobules, and these lobules, they further branch out and result in formation of further smaller lobules. So the salivary gland usually consists of two systems. One is the ductal system, one is the acinar system. And in the ductal system, that is, it is constitutes of first majorly it is divides into an intercalated duct, and this intercalated duct further divides into a striated duct, and then this striated duct which further divides into interlobal, or otherwise known as secretory duct, which is present in the form of which is present in between the lobules, so it is known as interlobar duct. Coming to the acinar cells, or also known as acini cells, it is known as acinar cell when it is considered as when it is being mentioned in a singular form, whereas acini it is considered when it is being mentioned in a plural form. So the secretory acini, they are the major salivary gland ducts which are lined by three generation of cells. One is they are lined by the low cuboidal epithelium cell at the intercalated portion. The next coming they are lined by the tall columnar epithelial cells at the interlobar duct, whereas at the secretory area of the duct, they are lined by simple epithelium. So there is a type of epithelium which we observe in a salivary gland tissue. So there is a picture where we see that initially we see that there is a salivary duct, and this salivary duct further is being leaded into an intercalated duct, and then this intercalated duct then being leaded into a interlobar duct. That is, we see that the duct is present within a lobule-like formation, because of which it is called interlobar duct. And then among the salivary duct, we see that they are tall columnar cells, or otherwise they are tall columnar cell with nucleus which is being placed away from the basement membrane towards the apex. Then coming is the intercalated duct, which shows cuboidal-like cells which show the arrangement of the nucleus at the center of the cell. The next coming is the mucous cells. Usually we see that the mucous cells, they usually show they are a group of cells with present with the nucleus being flattened and other pressed or compressed towards the basement membrane, and they show a tall pyramid-like shape of cells. Whereas the serous cells, they are larger, these cells are larger in size when compared to that of the mucous cells, and the nucleus is quite oval and round in appearance, which is placed at the center of the cells. And these cells, serous cells, they are larger than when compared to that of the mucous cells, with a larger lumen present in the center. And coming to the basement membrane, this basement membrane, it actually provides support to these mucous cells and the otherwise the serous cells also. And when the serous cells are being capped by mucous cells, they are known as demillions of serous cells. So this is a histological picture, diagrammatic representation of how the structures in a salivary gland appear. Coming to the secretions, usually parotid gland secretes serous secretions, which is completely purely serous secretions, whereas submandibular gland, it secretes both the secretions, among which the dominating is the serous when compared to that of the mucus. Sublingual also secretes a mixed type of secretion, so it is known as a mixed gland, but here we see that unlike that in the submandibular, sublingual shows predominantly mucus type of secretion. Coming to the minor glands, they usually show mixed type, serous, or otherwise mucus type of secretion, depending on the location where they have been placed in the oral cavity. So this is what is a salivary basic structure of a salivary gland tissue and its structures and the histological features of a salivary gland. Coming to the infections of the salivary gland, the first and foremost and the commonly observed infection, it is known as inflammation of the salivary gland tissue. That is salivary gland tissue when it is being exposed to any injury, and further on that on healing, where it shows inflammatory reactions, or otherwise directly de novo only it shows inflammation, that it is known as sialadenitis. And this stage it could be staged into acute stage or otherwise chronic type of sialadenitis, where acute it occurs rapid in onset, chronic it occurs gradual in onset. And the etiological features for the salivary includes viral infection, where we see which is a most common etiological factor, showing that the virus, it is most commonly caused by mumps virus, which is of a group of a family of paramyxovirus. And we see in mumps, usually the patient usually comes with a swelling, the swelling of the parotid gland known as parotitis. Other than that, it also shows features of orchitis as well as pancreatitis. So it's a triad inflammation of the mumps shows a triad of characters, three characters. So there is a viral infection which might result in inflammation of the salivary gland tissue. Then next coming is a bacterial and mycotic infections. They are usually very rare and most commonly seen in case of tuberculosis as well as actinomycosis. Coming to the autoimmune disorders, usually we see that this salivaritis autoimmune disorder cannot be rather direct etiological agent, but rather it might provide an environment by which it might result in silent So among these autoimmune disorders, most commonly it is a Mikulicz disorder as well as that of the Sjogren's syndrome, which show such type of conditions associated with it, that of silent Coming to the bacterial and mycotic infections, usually these infections they show acute silentinitis, and most commonly the causes include because of the acute infectious fever. In fever, usually we see patient is being dehydrated because of what there's obstruction of the saliva, and this can in turn result in inflammation of the salivary gland. Other than that, we also seen acute postoperative parotitis, where usually there's ascending of the microorganism from this parotid gland towards there's ascending of the microorganisms from mouth towards the parotid gland, in which there's that is why it is termed as acute postoperative parotitis. That is, after the parotid gland inflammation, this silentinitis can develop. Then other than that, we also see in old age people where there's silentinitis because of compromised saliva production and compromised function of the salivary glands, and even in debilitated patients also we see such kind of silentinitis. That is, patient when the patient is ill and weak, it in turn might result in silentinitis. Coming to the chronic silentinitis, the most common causes in chronic silentinitis is because of the recurrent obstruction which is occurring to the salivary gland duct or otherwise any function because of the formation of stones in the saliva. Formation of stones in the salivary gland duct is known as silolithiasis. So any obstruction might result in lack or disturbance or alteration in the flow of the saliva, which will result in chronic silentinitis. So there is one of the it could be one of the cause. And other than that, obstruction can also be caused during injury or otherwise in strictures. We see that strictures, it is nothing but narrowing of the duct of the salivary gland tissue. So amongst those cases also we see this recurrent obstructive type of silentinitis. So next cause, it could be because of the recurrent non-obstructive type of salivary silentinitis. It is most commonly seen when the saliva, there's reduced production of the saliva, such as a condition known as hyposalivia or xerostomia. This condition is probably not itself being induced, but rather on taking any medication such as antihistamines or antisalagogues, it might result in a condition known as hyposalivation or xerostomitis, because of which there is a recurrent non-obstructive type of chronic silentinitis. And other than that, we also see certain chronic inflammatory diseases where we see any inflammatory disease such as tuberculosis or leprosy kind of disease, where we see that there is chronic silentinitis being associated with such conditions. Coming to the autoimmune disease and their importance in silentinitis, we say that the inflammatory changes they are seen in salivary glands in two autoimmune diseases, mainly the Sjogren's syndrome. Sjogren's syndrome, it shows a combination of symptoms. Mainly, it's a triad of symptoms. That is, it shows keratoconjunctivitis sicca, that is dryness of the eye. Then xerostomia can be seen in this patient. Other than that, is also then other third feature is rheumatoid arthritis. So xerostomia in turn might result in silentinitis. So it is one of the etiological feature for silentinitis to occur. Next coming is the Mikulicz syndrome. Mikulicz syndrome also we see that there is enlargement of the salivary glands and the lacrimal glands. This enlargement of the salivary glands might result in a obstructive type which might induce silentinitis. So these are the autoimmune disorders which could be one of the etiological agent for silentinitis to develop. So there's a picture showing a histopathological picture showing the picture of silidinitis, where we see that microscopically we see that the patient microscopically we see that there's a chronic, usually the ductal epithelium. There's because the ductal epithelium, it might result in cytoplasmic vacuolation of the ductal epithelium, or otherwise this epithelial cells lining the present within the serous acini, they might show fibrosis also. In usually in initial stages, we see such degeneration and such changes in the epithelial cells, but rather in latter stages, that is in the chronic and advanced stage, we see that there is complete fibrosis of that duct. These are what the microscopic features found in a silentinitis. Coming to the morphological features, that is clinically, the patient might complain of local redness can be seen at the area of silentinitis, since it's an inflammatory reaction. And other than that, patient might also complain of pain, and there's also associated difficulty in swallowing wherever the location or the particular gland which is being involved. And in chronic stages, we see there's firm fibrous swelling of the associated structures in silentinitis. So these are certain morphological features and microscopic features of silentinitis. Next, coming is a classification of the salivary gland tumors. These salivary gland tumors, they can be classified broadly into benign tumors and malignant tumors. Among the benign tumors, they are being further classified into adenomas and mesenchymal tumors. In the adenomas, it is the first most commonly occurring tumor. It is the pleomorphic adenoma. Then comes monomorphic adenoma. Under the monomorphic adenoma, the other tumors, they are the Warthin's tumor, oxyphil adenoma, or also known as Oncocytoma. Other than that, the other types of tumors in the monomorphic adenoma, they are the Myoepithelioma, basal cell adenoma, and clear cell adenoma. So coming to the malignant tumors, it constitutes most commonly is a Mucoepidermoid carcinoma. Then coming is a malignant mixed tumors, which consists of carcinoma in X pleomorphic adenoma. That is a pleomorphic adenoma, which is being since pleomorphic adenoma has an increased recurrence rate, it might also turn up into a malignant tumors, which so in such conditions it is known as carcinoma in pleomorphic adenoma. Other than that, the other mixed type of malignant tumors, they are the Carcinosarcoma, which is very rare, and then is a metastasizing mixed salivary gland tumors can also be seen. The other common malignant tumors in very small ranges of occurrence, they are the adenoid cystic carcinoma, acinic cell carcinoma, adenocarcinoma, epidermoid carcinoma, undifferentiated carcinoma, and certain miscellaneous carcinomas, among them which is a malignant melanoma can be seen as one of the example, or epidermoid carcinoma can also be given as a miscellaneous malignant tumor. Coming to pleomorphic adenoma, which is a mixed type of salivary gland tumor. It is a benign tumor, and most commonly it is seen affecting the major salivary glands. Among the major salivary glands, it includes most commonly the parotid gland, followed by submandibular and sublingual gland. Among the occurrences of pleomorphic adenoma within the major and minor glands, it constitutes 60 to 75% of occurs in major salivary glands, whereas it occurs up to 50% in minor salivary gland tumors. And most commonly, usually the salivary glands, they are most commonly involved. Most commonly involved and occur in women when compared to males. There are only certain exceptional tumors which occur in males. So pleomorphic adenoma also, as like other salivary gland tumors, it occurs most commonly in female. And most commonly occurring age group is 3rd to 5th decade of life. And usually these patients, they present pleomorphic adenoma with a slow growing mass or a swelling, which is usually painless and shows a normal surface of the tissue. That is, it appears normally without any ulcerations or any discharge. And other than that, it occurs as a solitary tumor, that is as a single swelling, which is seen in the within the oral cavity. Suppose if it is involving the parotid gland, it is seen at an area which is present as a solitary swelling just before the ear, tragus of the ear. It can be seen. Coming to the prognosis, usually this pleomorphic adenoma, it is most commonly recurrent in nature. And shows an increased recurrence rate compared to the other benign salivary gland tumors. The treatment it includes is a complete resection of the tumor is done. In advanced cases, there's a partial parotidectomy or complete parotidectomy, which is being preferred based on the involvement of the tumor in that area, particular location. Coming to the morphological features, grossly, usually we see that it is usually a pseudo encapsulated tumor that is not completely encapsulated, but it might be partially encapsulated. And the surface, it is usually shows lobulated surface, which can be bossulated. On cut section, we see that there's occasionally they can be present of cystic spaces, and usually it is mucoid to soft in consistency when felt on palpation of the gross specimen. Morphologically, we see certain features, that is usually it is called as a mix, pleomorphic adenoma, that is pleo means multiple, and morphology means morphological features. So it shows multiple or varied morphological features, so it gives a mixed appearance. In this mixed appearance, the pleomorphic adenoma consists of two constituents. That one is the epithelial component, and then is a mesenchymal component. In the epithelial component, usually we see the cells, they are arranged in the form of sheets or acini, or otherwise in the form of ducts or tubular form. And then in the connective tissue component, we see there is a mixed presence of mucoid type, chondroid type, or even sometimes osseous type of tissue can also be seen. Other than that, when it is present in such type of mixed conditions, that is presence of all the cartilaginous, mucoid, and then the bony tissue, then it is known as myxoid type of mesenchymal or connective tissue element. So this is what we see in pleomorphic adenoma. So here in the histopathological picture, which is being stained with an hematoxylin and eosin stain, we see that they are varied morphology of cells, which could be probably the periphery ductal type of the duct lining epithelial cells. They are usually tall columnar or cuboidal in cells, whereas the inner cells, they show a spindle type of cells or oval type of cells. If they show a spindle type of cells, they are probably said to be of myoepithelial in origin, which is of smooth muscle origin. So there is a picture showing varied type of, first picture shows varied type of epithelial component with variation in the multiple variation in the size of these epithelial cells. The second picture showing that is the connective tissue component, which is showing a chondroid type of component with certain cartilaginous elements at one or two areas in the second picture. So this is what is about pleomorphic adenoma. The next, coming to another tumor known as Warthin's tumor. It is also known as papillary cyst adenoma lymphomatosum, or otherwise known as adenolymphoma. It is so called as papillary cyst adenoma lymphomatosum because histologically, when we see the histopathological slide under a microscope, we see that there is a papillary or finger-like projections of the tumor, which gives us a papillary type of appearance, and also presence of certain cystic spaces, because of which it is called as papillary cyst adenoma lymphomatosum. So it is a benign tumor, and it most commonly seen involving the parotid gland, and this is only one of the exceptional tumor which occurs in men more commonly when compared to female. Other than that, all of these salivary gland tumors, whether they are the malignant tumors or the benign tumors, most commonly are seen involving the females, and the exact etiology or the exact reason why the females are being most commonly involved is not yet been proved. And the most commonly involved age group of Warthin's tumor, it is seen most commonly in men among the age group of 4th to 7th decade of life. And we see that there is parotid duct epithelium in the lymph node, which is seen adjacent or within the parotid gland tissue. We see that is the parotid ductal epithelium. Usually it is supposed to be in the parotid duct, that is away from the gland. We see that there is involvement of this presence of this epithelium within the parotid duct or adjacent to this parotid gland. The treatment of Warthin's tumor, usually it is surgically removed, and it is not recurrent when compared to that of the pleomorphic adenoma. Coming to the morphological features, there is a picture of a Warthin's tumor where we see there is presence of lobulated surface with certain nodular-like structures which can see in the superficial or anterior part of the gross specimen, and it is usually firm to hard in consistency. On cut section, we might see certain presence of cystic spaces, which also shows greyish to white in appearance, or pale yellow in appearance can also be seen. And coming to the histopathological pictures, usually we see that there is papillary projections of this epithelium, and this epithelium is lined by two rows of cells, where the superficial row or the outer row, it consists of a tall columnar cell and centrally placed proliferating cells, which can be seen. Other than that, there are even certain cystic spaces. In the first picture, we see that they are nodular form of cells and also in the form of papillary projections. And the central area where we see that which appears white in color, it is known as the cystic space, which has been the cystic fluid and all of them, they have been lost during the processing of the biopsy specimen. The bluish color tissue, it mentions that the tissue is it is a resection margin area, which has been actually margined. It has been marked during the time of surgery. And the second picture showing a papillary projection, along with that separate island of a Warthin's tumor can also be seen. Other than that, there is also a cystic space which can be seen. And this Warthin tumor, the most characteristic feature, it is that papillary projections and presence of a double layered cell with centrally double layered tall columnar cell at the periphery and centrally placed oval or round neoplastic cells. So these are the characteristic features of Warthin's tumor. Next coming is the oxalophil adenoma, also known as oncocytoma. It is usually a benign, slow-growing tumor which constitutes only 1% of all the salivary gland benign tumors, and most commonly involved gland, it is the parotid gland, which constitutes of 85 to 90% amongst all the oxalophil adenomas. And it involves most commonly seen in females, where the gender predilection is towards some females. And the age group, it is usually seen in very elderly age group of 70 to 80 years. And usually we observe that the type of the growth in oxalophilic adenoma, or also known as oncocytoma, is patient might present with a firm, slow growing tissue or a tumor or swelling. And this mass on palpation or on a patient's history explains that it is a painless mass which grows, which is slowly growing in nature, and usually we see that this oncocytoma, this tumor, grows a maximum of up to 4 centimeters or below that of 4 centimeters, and it is being treated with surgical resection, that is, the tumor is being removed intact. So this is a picture showing the gross specimen showing a freshly excised oxalophil adenoma or oncocytoma, which can be seen. That is, right side of the tissue shows a normal salivary gland tissue, whereas the left side of the tissue here in the picture shows that it is a lobulated or a nodular kind of gross specimen. It is appearing such reddish in color because since it's a fresh specimen which has been removed from the patient, it appears giving a varying hues of red color can be seen. Coming to the microscopic feature, as the term itself suggests, that is an oxalophil adenoma or oncocytoma, since it consists of oncocytoma cells, that is, the epithelial-like cells can be seen. Other than that, it is also called as a mitochondroma because since there are certain mitochondrial granules which can be seen within these epithelial cells which can be dispersed, and this gives an appearance of lobular-like or nodule-like appearances can be seen. That is, the group of neoplastic cells which are being proliferating in the form of nodules, and they stay dark, deeply eosinophilic because of the presence of mitochondrial granules. This gives such an appearance, and usually it is connective tissue. We see there's presence of inflammatory cell infiltration along with certain collagen fibers can also be seen, and certain blood vessels can also be seen in the picture. So this is what is about oxalophilic adenoma. Myoepithelioma, it constitutes of less than 1% of all the salivary gland tumors, and amongst them most commonly it involves the major salivary gland as well as the minor salivary glands. Amongst the major salivary gland, it most commonly seen in the parotid gland involvement, whereas minor salivary glands, it is the palate which is most commonly being involved. Then it is most commonly seen in the adults with equal gender predilection can be seen. And clinically, it is indistinguishable from pleomorphic adenoma because of the same signs and symptoms which are being produced by myoepithelioma, like slow growing mass, which appears to be painless, and suppose there's any involvement or if the mass is grown too much, then it might result in facial nerve paralysis. Usually, myoepithelioma, it is preferred to be treated with surgical excision, that is, the tumor is being removed intact. And then the microscopic features, usually myoepithelioma, as the name itself suggests, it usually consists of presence of myoepithelial cells. These myoepithelial cells, they are usually the muscle cells which appears spindle shape, and They might also appear basaloid in appearance, or otherwise as plasmacytoid cells, or appear as clear cells. So these are the certain various morphological features of how a myoepithelial cell appears in myoepithelioma. So this is a histopathological picture which has been stained with hematoxylin and eosin, showing a biopsy of a palate, where we see that the myoepithelial cells, that is these proliferating neoplastic cells, they are composed of plasmacytoid cells, that is where the nucleus is pushed towards one end, which gives us a which gives an appearance of a plasma cell, and this can be seen here where there are bulk of plasmacytoid cells which can be seen. Other than that, there are also various cells such as a basaloid cell can also be seen in myoepithelioma. So these cells, they can be separated from each other. These cells which are composed within a duct or otherwise in a tubular form, they are being separated from each other with the help of fibrous septa or otherwise connective tissue septa. And based on the ultrastructural level, when we see that this myoepithelial cell tends to appear as a proper basaloid cell with proper development of the basement membrane, and there's also presence of cytoplasmic intracytoplasmic myofilaments can also be seen, and the adjacent cells, that is the myoepithelial cells, connect with adjacent cells with the help of desmosomal junctions, which can be, all of them can be observed at an ultrastructural level. So next coming is a basal cell adenoma. It is usually a neoplasm of the basaloid epithelial cells, that is the basal layer of these cells, epithelial cells. These cells, they proliferate or they undergo certain changes and result in a neoplasm or a tumor. And usually this is thought to be occurring, the major reason or the origin for this tumor is from the intercalated duct or otherwise the reserve cells, which usually undergo mutations or any injury and result in a formation of produce an abnormal population of cells known as basaloid cells. Most commonly involved glands are the salivary glands. Amongst the salivary gland, it is the most commonly is the highly occurring in parotid gland, next followed by the other glands. And clinically, the patient might give a complaint of slow growth of the tumor, which is painless in nature. And usually, it is mostly found among the age group of above 6 decade of age group, that is 51 to 60 years onwards, can be seen. And there's a tumor which is also unlike other tumors like Warthin's tumor. We see there's female predilection, where the ratio of gender between the females and males measures 2:1 ratio. And this swelling, on clinically observation, on clinical examination, we see that the swelling is firm and it is cystic and compressible. So these are the certain clinical findings of the tumor. And treatment, patient is usually surgically excised for this type of tumor like basal cell adenoma. Coming to the histological features, usually we find that the cells are basaloid in appearance. Usually we find that the cells are basaloid in appearance, that is, they give a cuboidal-like of shape with a nucleus placed towards the basement membrane, and with proper keratinization and squamoid appearance can be seen. And there are two morphological forms. These cells, basaloid cells, they can either appear as a small cell or otherwise large cell. Suppose if it is a small cell, there's scanty cytoplasm, that is, there's very little bit of cytoplasm, but the nucleus, it stains very deeply and it is deeply basophilic with the basophil stain, that is part of hematoxylin and eosin stain, and then it appears round in shape. Then coming to the large cell, it shows since it is large, there is also properly amount of eosinophilic cytoplasm when compared to that of the small cell, and there is also ovoid pale staining nucleus which can be seen. Based on the morphological pattern, that is arrangement of these tumor cells, it has been classified into 4 patterns. First one, it is a solid type, where we see that these neoplastic cells, that is the basaloid cells, they are arranged in the form of cords or otherwise islands or in the form of strands, which are being separated by fibrous septa. And then we see that the second type, it is a tubular type, where we see a duct-like arrangement of these cells, and in the duct-like arrangement we see that the peripheral layers, that is outer layers, they are formed with a cuboidal type of cells, whereas the inner neoplastic cells, we see they are arranged in the form of round or oval type of shaped cells. which have been scattered within the duct-like or tube-like structure. So it is known as tubular type. Then next coming is the trabecular type. The cells we see is similar to that of the solid type, that is basaloid in appearance, but rather the arrangement of these cells is in the form of a reticular pattern, that is interconnecting cord-like pattern or ducts which interconnect and give a trabecular or reticular type is known as trabecular type of pattern seen in this tumor. Then coming as a membranous type, where we see that there's much of eosinophilic staining which can be seen along with certain cystic spaces, which gives us a membranous type of arrangement. So this is what is about the basal cell adenoma. The next coming is a Mucoepidermoid carcinoma, which is the most common malignant tumor and which constitutes 29 to 35% of all the malignant salivary gland tumors. And it most commonly involves amongst the major gland, it is a parotid which is most commonly involved. Then among the minor glands, it is a palate which is seen in the salivary gland involvement. And it also shows female predilection when compared to males, and most commonly involved age group is from the 3rd to 5th decade of life. And it shows two types of grading, that is a tumor of low grade malignancy and then tumor of high grade malignancy. In tumor of low grade malignancy, we see that these tumors, they are usually slow in growth and they are painless, and the tumors they might show very they might appear similar to that of the pleomorphic adenoma clinically, and they are also not encapsulated alike with that of pleomorphic adenoma. Whereas in tumor of high grade malignancy, we see similar feature, but rather we see that the patient, the tumor is fast growing tumor and the patient might complain of pain. Other than that, we also see the even surface changes when compared to that of the low grade tumor. That is, the surface might appear bosselated or ulcerated in appearance in case of high grade malignancy. Coming to the histological patterns, usually as the term suggests, Mucoepidermoid, we see three generations of cells, that is 3 variate cells population. One is the mucous cells, one is the epidermoid cells, and one is the intermediate cells. These mucous cells, they are the cells which appear oval or round in appearance and with a densely stained nucleus at the center, whereas the cytoplasm is scanty and it gives a foam-like appearance because of the probably it is because of presence of mucin, because it stains positive for mucin with certain cells like PAS stain, that is periodic acid skip stain. So it is a one of the type of cell known as mucous cell. The next coming is a epidermoid cell. This epidermoid cell, it is a cell which is derived from the epithelial cell, that is the basal layer of the epithelial cells of the basal layer, which appears as a cuboidal to columnar in shape with a nucleus placed towards the end of the cell or the basement membrane. And this is so-called epidermoid because of its appearance with that of the squamous epithelial cell. The next coming is the intermediate group of cell. It is so-called intermediate group because it gives an appearance of both the mucus as well as that of the epidermoid cell. And based on certain studies, it has been observed that this intermediate cell could probably be the progenitor which would give rise to the mucous cells as well as that of the epidermoid cells. So these are the 3 variation cells which we see in a mucoepidermoid carcinoma. So other than that, we also see certain grades of the tumors, that is a low grade tumor, high grade, intermediate grade tumor, and the high grade tumor. Among the low grade tumor, we find that the predominant cell type here in low grade tumor, other than the epidermoid and intermediate cell, mucous cell predominant then compared to the other population of the cell. And there's also presence of numerous cystic places which can be seen in this tumor. And coming to the atypia, that is the dysplastic feature, since it's a malignant tumor, we find certain dysplastic features, and these dysplastic features are such as altered nuclear cytoplasmic ratio and changes in the nuclear shape and this cell shape, all these mitotic figures, all this we see minimal dysplastic features, that is minimal atypia can be seen in low grade tumor. Because of this minimal dysplastic features, the prognosis could be considered better for low grade tumor when compared to intermediate and high grade tumor. Coming to the intermediate grade tumor, we find in this intermediate grade tumor, we find that the intermediate cell predominate, that is those cells that is which could be show an appearance of the mucous cells as well as that of the epithelioid cells. These cells predominate compared to the cystic spaces. When compared to that of the low grade tumor, the cystic spaces are lesser in intermediate grade tumor. And it also shows a certain more of atypical features or dysplastic features when compared to low grade tumor. It shows intermediate prognosis in case of intermediate grade tumors. Coming to high grade tumor, we see all the population of cell. Among them, the predominant population, it could be the epidermoid cells, and they are lesser cystic spaces seen, and they are increased in the mitotic figures and increased atypical features, that is abnormal variation in the nuclear features and the self-shape cytoplasmic features can be seen. Other than that, they can also be seen pycnotic nucleus can be seen, abnormal mitotic figures, increased in the number of mitotic figures. All these of this can be seen in high grade tumor, and the prognosis is poor for this high grade tumor. So the picture here, it shows a hematoxylin and eosin stained mucoepidermoid carcinoma, where the first picture it shows a pointing with an arrow mark shows a mucus cell, then shows an intermediate cell, and then shows an epidermoid cell. So this is what the picture showing with varied group of population of mucoepidermoid carcinoma. Then coming as the next picture, which is an FNAC stain. So this FNAC picture shows varied population of the mucoepidermoid carcinoma cells. The treatment, it usually includes conservative excision is done, that is by preserving the adjacent structures. When a parietal gland is involved, we should see that the facial nerve is being preserved properly. Coming to the next tumor, it is a carcinoma and pleomorphic adenoma. It constitutes 8.8% of all the mixed tumors, and whereas 4.6% of all the malignant salivary gland tumors. It is a tumor, as the name suggests, it's a carcinoma in pleomorphic adenoma. That is a pleomorphic adenoma which has been already existing, might show certain carcinomatous features, and otherwise this pleomorphic adenoma, suppose if it is not properly removed or incompletely removed, because since it is most commonly seen involving the parotid gland, and since facial nerve passes through this parotid gland, when the surgeon actually tries to preserve this facial nerve, and the parotid gland is the pleomorphic adenoma tumor is not being sufficiently removed, then this might turn into a carcinoma, pleomorphic adenoma. In other cases, we also see that there could be an accidental implantation of this pleomorphic adenoma, and this result in carcinoma and pleomorphic adenoma. And it is most commonly seen involving the parotid gland, and then next followed by this is the submandibular gland, and then comes the minor gland, that is the minor glands of the palate. So these are the involvement of the location of the carcinoma on pleomorphic adenoma to occur. And most common age group, it is a wide range of age group which shows from 51 years to 90 years. We can see that it's seeing involved. The next, the clinical features, patient might give a complaint of painless mass or a history of already being treated pleomorphic adenoma can be seen. And in progressive cases, we see that the facial paralysis is seen most commonly when the parotid gland is being involved. And the treatment, patients are suggested for resection, and radiation is being supposed to be advised, that is after the operation. After the resection, patient is advised for radiation therapy. So there is a picture showing a pleomorphic adenoma. The first picture showing the pleomorphic, that is a pleomorphic adenoma already being existing, and the next arrow mark, the arrow mark towards the downwards of the first picture, explains that they are being shown certain atypical features, that is the carcinomatous features can be seen. Since it's of a low power view, the features are not being much appreciated. And then the next picture showing a high power view of the carcinoma and pleomorphic adenoma, where the arrow mark indicates the presence of abnormal mitotic figures, and there are numerous mitotic figures as pleomorphic nuclei as well as cytoplasmic shapes can be seen. So this is what explains a carcinoma and pleomorphic adenoma. Next coming is a Carcinosarcoma, which is actually a very rare condition, and this, as the name suggests, it consists of both the sarcomatous part and as well as the carcinoma part. It is usually de novo, that is, it arises upon its own, or otherwise it might also arise in association with the other tumors such as mixed benign tumors. It can be seen, and most commonly involved area, it is the parotid gland, and seen in an age group of elderly patients, that is of above 60 years. and there's no sex predilection, that is the gender is being equally showing importance. Being involved in carcinosarcoma, and the patient, he might complain or give a complaint of swelling, pain. Along with that, there might be certain ulcerations which can be seen. Suppose being based on the involvement of the location, patient might show palsy also. That is, if it is being involved in the facial nerve is being involved in, when the carcinosarcoma of the parotid gland, then it might involve facial nerve paralysis. The treatment, usually it's the combination of treatment wherein radical surgery is done, along with that neck dissection is done, and post-operative radiation can be done. Based on the stage of the tumor, the particular treatment is being prescribed. Coming to the metastasizing or mixed tumor, there is usually a benign pleomorphic adenoma that develops into a metastatic deposit. That is, when the pleomorphic adenoma in an advanced cases, when it starts spreading to the other tissue, infiltrating into the other parts in the body, then it is known as a metastasizing tumor. That is, since pleomorphic adenoma is a mixed tumor, it is known as metastasizing mixed tumor. And most commonly involved are the major salivary glands. Usually, there's a lot of time lag between the primary diagnosis of the tumor and for the metastasis to occur. So there's a long interval between the primary diagnosis and the for the manifestation of the metastatic tumor. And histologically, we see that there's typical features of that of the pleomorphic adenoma, that is presence of varied population of the cell, that is based on the morphology, as well as the connective tissue component might also show myxoid, cartilaginous, osseous, as well as mucoid type of cartilaginous connective tissue. So this typical features of pleomorphic adenoma can be seen histologically. The primary neoplasm, when we see that is in the beginning stage, we see that it is a solitary well-defined mass, that is, it is a single mass, but later it might progress and result in a lobulated or multilobulated and give us a bosulated-like appearance. And usually, coming to the prognosis, there is usually wide recurrence which can be seen even after excision of the primary neoplasm, as similar to that of the pleomorphic adenoma. Since pleomorphic adenoma, as already explained, shows increased recurrence. Similarly, we see in metastasizing mixed tumor, there is wide recurrence occurring in these patients. Coming to the next tumor, it is the adenoid cystic carcinoma. Usually, it is a carcinoma which resembles pleomorphic adenoma clinically, but it can be distinguishable from pleomorphic adenoma based only on the histopathological features. So, it is also similar features showing as that of the pleomorphic adenoma, showing slow growth, and it is aggressive and showing increased recurrences. And most commonly involved glands, it is a parotid gland, then next is the submaxillary area, then next is the minor salivary glands, that is the accessory glands which are present within the palate and the tongue. And clinically, we observe that is the patient might give a complaint of pain. Along with that, since the parotid gland is most commonly involved, if it is involved, then the patient facial nerve paralysis and its associated symptoms can be seen. On palpation of the tumor, we see that it is being fixed to the deeper tissues, and other than that, we see there's invasion also in histological features. That is, it's spreading to the underlying from the epithelium to the connective tissue. And intraorally, when the lesions are present intraorally, we see that there's ulceration, which is a characteristic feature of malignant tumors. And the most characteristic feature of adenoid cystic carcinoma is this carcinoma, it spreads through perineural spaces, and it usually invades, or it progresses deeper beyond that of the clinical borders of the already involved structures. So this is one of the characteristic feature of adenoid cystic carcinoma. So this is a picture, histopathological picture showing the presence of the neoplastic cells, which are composed of the epithelial cells, myoepithelial cells, that is composed of these, which appear as spindle-shaped cells derived from a smooth muscle origin, as well as ductal cells. They could be cuboidal or columnar in shape with varied arrangement, and this varied arrangement, it could be in three patterns. One is the cribriform pattern, that is they are present in the form of tubular structures which are being interconnected, but they appear flat in nature. And these myoepithelial cells and ductal cells are present within this cribriform pattern. Other than that, we also see tubular pattern, that is they are duct-like. These neoplastic cells, they are arranged in the form of a duct-like structures which can be passing throughout the tumor. And the solid pattern we see in the form, the neoplastic cells, they are arranged in the form of cords or otherwise in the form of islands or otherwise in the form of sheets, where these cells, they predominantly proliferate. And so solid pattern is the pattern which shows a poor prognosis when compared to the cribriform and tubular pattern. And the treatment, patients are usually advised for the carcinoma to be removed or resected. So there is a histopathological picture showing the cribriform pattern of the arrangement of myoepithelial cells and the ductal cells. With certain normal salivary gland tissue can be seen at the left side of the picture. Coming to acinic cell carcinoma, it is a carcinoma which shows the neoplastic cells. They express acinar differentiation, that is the acinous cells, that is the serous acinous cell or the mucous acinous cell or the mixed type of serous and acinar cell. They differentiate and result in a formation of neoplastic group of cells, and this together constitutes the acinic cell carcinoma. Most commonly involved region, it is a parotid gland, and other than that, they are the accessory intraoral glands which could involve either in the palate or in the tongue or in the buccal mucosa. And most commonly seen, females are most commonly seen when compared to males, and the ratio among the females to males, it is 3:2 ratio. And the middle age group of above 50 years can be seen most commonly affected with acinic cell carcinoma. Clinically, we observe that it's a slow growing tumor, and on palpation we see it could be either a mobile, and if it is a progressive, then it can be fixed to the underlying structures. And the patient is usually asymptomatic because it's a painless tumor and it is slow growing. It might rather be neglected by the patient. And we also see that there's facial muscle weakness since it is involving the glands which are present within the face. There's facial muscle weakness, and it involves if suppose this tumor occurs and it is progressive, then there's bilateral involvement. So it is known as bilateral synchronous tumors, because if it involves this parotid gland, then both the right and left side of the parotid glands, both of them are being involved with this tumor. Coming to the histological features, usually we see that since it's a proliferation of the serous cell, mucous cell, and the mixed type of cells, we see presence of such cells. In the pattern, usually we see they are arranged in the form of solid pattern, in the form of acini or cords, and this solid pattern shows many atypical features. That is, they do not resemble that of the parent cell. That is, they do not that of the acinar cell. The next type of pattern, we see papillary and cystic pattern. That is, the neoplastic cells, they proliferate in the form of papilla or finger-like projections, and this papilla, they shows many cystic-like spaces. That is, on a histopathological slide, when viewed under a microscope, we observe it as a clear spaces. So this comprises the papillary cystic pattern of acinic cell carcinoma. The next coming is a follicle pattern. That is, the neoplastic cells, they are arranged in the form of follicles. That is, they separate with that of the adjacent tumor, and they are dispersed in the form of follicles or in the form of area of island type of structures. So this comprises the follicular pattern. So coming to the microcystic form, usually we find there's numerous cystic spaces in this microcystic form. Other than that, we also see certain clear cells also in this microcystic form. As well as dispersed neoplastic cells which are diffusely seen scattered throughout the tumor area can also be observed. So there is a histopathological picture showing stain with an hematoxylin and eosin stain, showing proliferation of the neoplastic acinar cells. There's also present of minor microcystic spaces can be seen with presence of one or two, three clear cells can also be seen, and there is mostly seen infiltrated connective tissue. We can see there are numerous hemorrhagic areas can be seen within the connective tissue. So this is what is a histopathological picture of an acinic cell carcinoma. Usually the treatment, it involves surgical excision. The patient is advised to for the complete removal of the tumor. Coming to adenocarcinoma, adenocarcinoma is a carcinoma which most commonly seen predominantly occurring in the minor salivary gland area, and it is usually seen in an age group of 50 to 80 years of age group, and showing female predilection when compared to male in a ratio of 2:1. And clinically we see that this tumor appears as a firm and non-tender swelling when it is seen in the as associated with the mucosa of the palate. It could be in the soft palate, hard palate, or at the junction of the soft and hard palate, in the cheek as well as in the upper lip. And the clinical features we see is there's bleeding associated with the tumor, as well as ulceration can be seen, telangiectasias can be seen, that is dilated blood vessels being associated with, can be seen underlying this mucosal area. And the treatment, it is wide surgical excision is being advised for adenocarcinoma. Coming to the histological features, usually we find that there's wide variation of growth patterns. We find the proliferation of the cells either in the form of a solid pattern, that is an arrangement of these neoplastic cells in the form of cords or acinics, or in the form of sheets, or otherwise in the ductal pattern, that is in the form of tubular pattern with arrangement of 2 rows of cells, or otherwise in the cystic pattern showing numerous of presence of cystic spaces can be seen, or otherwise in the tubular patterns it can be seen, that is they are arranged in the form of tubules, and otherwise in the cribriform pattern, that is the flattened cells with interconnecting tubules. This is known as a cribriform pattern. So there is a histopathological picture being stained with hematoxylin and eosin stain showing numerous microcystic spaces along with certain varied variation of population of cells showing the mucous cells as well as the serous acinar cells, and there are even certain hemorrhagic spaces being present. And the tumor stroma, it usually stains positive for hyaline because it is made up of, maximally it is made up of mucoid material. And the most characteristic features for this is it is also infiltrative and shows perineural invasions alike that of adenoid cystic carcinoma. Coming to the undifferentiated carcinomas of the salivary glands, usually these are undifferentiated. What it means is they cannot be differentiated, or they cannot be matched with other salivary gland tumors. So it is termed as undifferentiated, and they lack certain. It is so called undifferentiated because differentiation means that is a resemblance of the daughter cells or the offspring cells with that of the parent cells. So these undifferentiated carcinomas, they lack such differentiation and they lack such resemblance with that of the parent cell. So the morphological features, they lack specific morphological features. And histologically, when we see that they are similar to that of the undifferentiated carcinomas of other organs and tissues. And they are usually classified into small cell undifferentiated carcinoma, large cell undifferentiated carcinoma, and lymphoepithelial carcinoma. This small cell undifferentiated carcinoma, it is so called because of the morphological features of presence of usually small cells, and these usually resemble that of the lymphocytes. Then it could be called as the large cells when they are present of other mononuclear cells predominating in this carcinoma. It is known as the large cells. When it is being seen with a lymphoepithelial carcinoma, that is involvement of the lymphocytes as well as the epithelial component of the cell, and seeing involvement in the lymph node, then it is known as lymphoepithelial carcinoma. So these are the certain undifferentiated carcinomas of the salivary gland. The treatment, usually patient is advised for surgery alone or otherwise surgery with radiotherapy, since it's a high grade tumor showing with a poor prognosis. Coming to the miscellaneous malignant tumors, usually we see the tumors among the miscellaneous, they are the epidermoid carcinomas and the malignant melanoma. Among the epidermoid carcinoma, it is so called because they show features of that of the squamous epithelium with which shows squamous in nature, and keratinization can also be seen, and the cells, they resemble that of the epithelial cells with low columnar cells or cuboidal cells with centrally placed nucleus, and these are termed as epidermoid carcinomas. Most commonly they are seen involving the skin, and less commonly seen, very rare percentages of tumors are seen involving that of the oral cavity, and that too these could be probably the invagination or invading epidermoid carcinoma of the skin deepening into the oral cavity tissue or the cheek mucosa, resulting into an epidermoid carcinoma of the oral cavity. Then next coming is a malignant melanoma. It is also known as a melanoma, which is most commonly seen the tumor cells that of the melanomas or the melanocytes, melanin containing cells, they differentiate when they are being mutated, they differentiate and give rise to a undifferentiated or pleomorphic cells, which might result in a neoplastic proliferation of this abnormal melanocytes and result in malignant melanoma. So these are certain miscellaneous malignant tumors. Thank you.